Not all heart surgeries are bypass surgeries. Sometimes your heart can fail even if the arteries are normal. Sometimes the problem is in its valves. What are these valves? Imagine your heart to be a big house with four big rooms. Each room is protected by a one way door. Yes, your heart has doors, and if it gets jammed, it gives rise to problems. In this video, I'm going to talk about one of the most important valves, the mitral valve, and its surgery, what goes wrong, and how to fix it. The mitral valve is like a one way door between two very important rooms, the left atrium and the left ventricle. It is made up of two small doors, also known as leaflets. Its job is very simple: allow blood flow to go forward, prevent it from coming backward. Why is this mitral valve very important in adults? It's because it acts as a gate between the lungs and the heart. Sometimes it misbehaves in two ways. In mitral regurgitation, this door doesn't close properly, because of which there is leakage of blood into the previous room or the chamber of the heart, thus increasing the pressure inside the heart and eventually increasing the load on the lungs. Because of this, both heart and the lungs can fail. It's like a door that won't shut during a storm. In mitral stenosis, this valve or the door doesn't open properly, so it is difficult for the blood to go from one chamber to the next chamber. It's like trying to enter a room with the door half open. Over time, pressure builds inside the heart and eventually the heart weakens. Patients may classically experience breathlessness, fatigue, palpitations. They often say, "Doctor, I'm not able to do what I used to be able to do before." Now comes the big question: how do we fix this? We have two options. In repair, we fix your own God given valve. Think of it like repairing the hinge of the door instead of replacing the whole door. Mitral valve, as compared to the aortic valve, is much easier to repair in select conditions. It preserves the natural God given valve. There is no replacement to it. The functioning is better, no need for lifelong anticoagulation. But not all valves can be repaired. If the damage to the valves is beyond repair, then we have no other choice but to replace it. Don't worry, even after valve replacement, your heart will work just fine. In replacement, patients have two choices. First, mechanical valve. These valves are made up of metals, most commonly pyrolytic carbon. These are very durable. Advantages: it can last your lifetime and it is comparatively cheaper. It is good for younger patients. Disadvantages: patients need to take lifelong blood thinning medications so that this valve functions normally. Bioprosthetic or tissue valves are made from animal tissue, most commonly bovine or cow, and porcine or pig. Advantages: no need for lifelong anticoagulation, and these valves give a much more natural flow to the blood. It is good for older patients and those who cannot take blood thinning medications for a longer time. Disadvantages: the lifespan of such valves is less as compared to the mechanical valves and may require a second surgery in case of degeneration. This decision is not one size fits all. We doctors, along with you patients, we consider the age, lifestyle preferences, the ability to take lifelong blood thinners, and patient preference before we take a decision. So, next time, if you're advised valve replacement, do discuss with your doctor in detail about which valve suits you the best. So, remember, heart problems is not just about blockages. Many a times it can be because of valves. Good news: modern surgery can easily fix it, and the outcomes are excellent. We are not just changing paths, we are improving your lifestyle and restoring quality life. If this video has helped you understand your heart better, share it with someone who thinks heart surgery is only bypass surgery. Do like and subscribe to my channel if you like heart related content made easy, because I believe heart related education should travel faster than heart disease itself. Thank you.